Okay, as part of our ATTD wrap up, I'm here with Terry Lawver from Dexcom, the Chief Commercial Officer. Terry, thank you so much for your time today. Really excited to dig into what I learned from the Dexcom Symposium and all the amazing things that Dexcom is bringing to market.
Great to be with you, Rob.
So, for starters, let's talk about the big announcement. Let's talk about Stello, which is Dexcom's new CGM into the market specifically for people with type 2 diabetes who are not on insulin. I think that's the big differentiator there as we talk about the differences between some of the sensors.
Sure. And thank you for bringing that up. We are really, really proud of the continued innovation led by Dexcom. And this is another in a long line of Dexcom first, the first CGM product approved by the FDA that will be available without a prescription or over the counter OTC, as we say. And, Rob, like all of our innovations, Stello really stemmed from what we hear from the customers and from the users, from their families, and even in some from the physicians. And as we have several people today who are not using insulin, who are using our current products, our G6 and our G7. And while they love those products, what we've heard from them is that their needs in some ways are really different from those people who are on insulin. So as your audience is very well versed in all things diabetes, you all know that of course for people who are taking insulin, some of the most important features beyond of course the minute to minute measurement of your glucose are some of the really important safety features that we have on our Dexcom G6 and G7. Now, these are the most accurate sensors on the market. And that accuracy and the algorithms allow those products to give you alerts if you're running too high for too long, and really importantly, urgent low soon, the alert that will tell you if you're about to go low 20 minutes before you do, so you can prevent that event, as well as some really important features like share follow and connectivity to automated insulin delivery, a whole bunch of features that are just absolutely critical, life-saving and life-changing for people who are using insulin. Now, what we've heard from people who have been trying those products but who are not using insulin is for that population, some of those safety features are less important to them, but there are some other things that they want. And the way that they describe it to us, we use two phrases that we hear from that population. The first is they say they want all of the insight without the interruption. And the second is they say that they want to be nudged, not judged. So I
Mm.
let me explain both of those. So all of the insight without the interruption, for anybody who has diabetes or even pre-diabetes and is trying to track your glucose, doing that without a CGM, I say it's like driving down a dark country road at night with no headlights and no street lights, right? You're like bad things are happening, but you don't really understand why. And wearing a CGM is like turning the lights on. It makes the invisible visible, right? And so this population who is not using insulin, they want those insights, but they don't need the alarms and alerts, right? And so that's the all of the insight without the interruption. The nudged, not judged is, for people who are managing type 2 diabetes, and I have several family members who I've been through this with. It can be incredibly frustrating because often you go to the physician, you're told that you have to maybe eat less, exercise more, you're told to lose weight. And somehow, and even though people are incredibly motivated and trying, it's not always working. And what CGM does, and Dexcom CGM and Stello in particular will do, is give people the insights and the encouragement to be able to connect the dots between food choices, activity choices, and other things in our life that can affect our glucose, caffeine, sleep, right? There are a whole bunch of things that impact our glucose numbers. And what we hope to do with Stello is provide that positive reinforcement about what is working, and then the insights that maybe are not working, but doing it in a way that more encourages, so as we say, being nudged, not judged, in terms of being able to take control of their health.
I really like that nudged, not judged. The wordplay is really fun, but also just the overarching theme because you're right. There's so much stigma in the not only in the diabetes community, but externally outside the diabetes community. So much of diabetes awareness outside of people living with diabetes is rooted in a lot of that stigma. And there is a lot of shame. And it does take courage for someone with type 2 diabetes not on insulin to opt into a CGM, to take charge of and really take ownership of trying to make that change. And so any sort of positive reinforcement along the way, I think obviously, contributes to what we want, which are better outcomes for those patients. So I do want to talk a little bit about like the alert fatigue, which I think was a big theme in the symposium at ATTD. And I also want to kind of float that into, all of the knowledge that the Dexcom team has across the suite of products over the course of over the years, and really like the driving insight, which is, you know, o- adding a CGM and continuous glucose monitoring ultimately at the end of the day results in a significant reduction in A1C, HbA1c levels. So can you just talk about like for you and the internal teams at Dexcom and like the innovation and what drives you guys, like looking and seeing those numbers, like what does that make you guys feel like?
That's a great question. Our mission at Dexcom is empowering people to take control of health. And there's nothing more frustrating as a human being when you're trying to achieve any goal than feeling like it's out of your control, and nothing more empowering than feeling like something is in your control and that you know what to do and you can see the results. That recent book Atomic Habits talks about the importance of immediate feedback, and that's one of the beauties of Dexcom CGM. It gives you that immediate feedback. And we've known this for a while, and now after many years of utilization and utilization by broader and broader audiences with Dexcom, some of the data that we're seeing now even goes beyond better control of A1C. Of course, Dexcom CGM does that in a really compelling way. But there have been a couple of pieces of data, and I think you were at the ATTD meeting last week, so you saw some of this data as well that we were really, really proud to share on a couple of fronts. First is or this meeting and past meetings, we've shared data from the Commissaire long-term study outcomes that shows for the first time, for example, a reduction by almost half in the occurrence of diabetic retinopathy in people who are using CGM
Mm.
versus those who are using BGM. So we're actually saving people's sight. For people who are using GLP-1s, which is all over the news today, right? That's usually, I have to say, when I'm doing interviews these days, that's usually the first question that comes up. And look, those are really important therapies in the arsenal of treating diabetes. We have relatively recent data that shows if somebody's using a GLP-1 alone, on average, they might get an A1C reduction of 1.0, but when they're using a GLP-1 plus a Dexcom CGM, that A1C reduction is almost 1.9. And so that's a really meaningful additional complementary benefit. There was also new data last week at ATTD, in fact, showing reduction in mortality associated with CGM use. I should be clear that that data doesn't show a direct causal relationship, but it certainly is correlated. Use of CGM correlated with reduction in mortality for type 1 and type 2 diabetes. So as we get more and more data, we get more and more insights about what's working, what are the benefits, and also what are the things that we have to continue to advance to make the technology even better.
I think for our audience, because we've made a really conscious choice, especially in the last 18 months, to say the uncomfortable C word of complications out loud and to address those issues that people with diabetes are facing, especially because the good news is people with diabetes are living longer. And what used to be a death sentence for both type 1 and type 2 is now more manageable because of the technology and the research and the medications that are coming on the market. So to be able to hear from you guys that 50% reduction in diabetic, which is a common fear for people with diabetes, I think for many years, where they wonder if they're going to lose their sight. And when you look at like the microvascular complications around diabetes. So for those of us listening to this podcast wearing a CGM, just know you're doing the right things. And even if sometimes, those alerts go off and you're having those days of diabetes burnout, that's really encouraging to hear when you zoom out the long running impact of the technology.
I really, really appreciate you saying that, Rob. And it's one of the most inspiring things for us, all of us who have the privilege of working at Dexcom. We often get letters, get emails, or get pulled aside if I'm wearing a Dexcom hat while I'm on vacation with my family. People will pull us aside or tell us all the time, anecdotally, how impactful this technology has been in their life. And that is incredibly inspiring. That's what motivates us to do what we do and to be better every single day. Now to see some of the data to demonstrate what this means at a macro level on a broad scale, at a population health scale is incredibly rewarding as well.
So when you think about that and you see your team put together the symposiums and the new product releases for the future of diabetes care, what gets you and your colleagues at Dexcom excited about the future of diabetes care?
That's, a great question. There is unfortunately some challenging data that we see at the macro level, in particular in the US. If we look at on the type 2 diabetes side, if we look at the population maps and the rates of obesity and type 2 diabetes over the last 10 or 15 years, it used to be that the highest rate of obesity in any given state on those maps was 30%. And now the new maps, we have up to 50% rates of obesity in many states and diabetes up to 30% of the population in some. So this is one of the greatest healthcare challenges for the developed world today, both from the standpoint of physical health, but also from the standpoint of economic health and our ability to treat our populations for all diseases and all wellness. CGM is one of the most important tools we have in our toolbox that has the potential to actually bend that curve. And some of the data that we talked about with mortality, with A1C reduction, with retinopathy and other complications tells us that that's possible. The other thing that we're really proud of and that we continue to invest in and work toward every single day is ensuring that these products are affordable for the people who need them and that they save the health system money. So those two things go hand in hand. So let me start with the save health system money. We have some very compelling data that's been published that demonstrates that on average, somebody using a Dexcom CGM can save the health system up to $500 a month on other healthcare costs because of avoiding all of those complications and other bad events. But those outcomes, those economic outcomes can only benefit the health system if people actually use the CGM. And people can only
Right.
use the CGM if it's affordable to them. So the other place that we've invested is working very closely with insurance companies, investing to generate and demonstrate the data showing all of these benefits so that insurance companies are absolutely willing to and gladly willing to cover CGM. So in the US, for example, for anyone on Medicare, anybody who's on insulin or is at risk of hypoglycemia now has full access to Dexcom CGM with a standard Medicare copay, and Dexcom led the clinical trial work to help make that happen. For people in the US with private insurance, the average copay is less than $20 a month. And we're continuously working to make that better. And there are outliers, population for whom it's higher. We're aware of that. We're continuously working to make sure that everybody who needs this technology, it is accessible, it is affordable with the lowest out of pocket cost of any option that they might have.
There was some compelling data, and thank you for saying that because I think it's a really important piece when we talk to executives to understand like that access is such a critical issue. And in the Dexcom symposium, I'm reading here just two quotes that I thought were especially relevant. In every country, type 2 diabetes is overrepresented in native populations and underserved populations. So obviously, access continues to be a critical piece. And that's actually the first A in my three A's of ATTD recap that is going live on Diabetics Doing Things this week. But the next piece is that globally, the cost of diabetes is $825 billion. And then the top three countries are China, the US, and India. And so when you think of saving $500 a month to the health system for someone on CGM and now opening up Dexcom to the type 2 diabetes, the over the counter diabetes market, you can obviously, and your teams of analysts, I'm sure, have done this much quicker than my napkin math. But those numbers start to really swell, and like the impact on those improved outcomes on the health system can obviously take a huge economic shift in a country like the United States where diabetes is so prevalent.
That's exactly right. And I said we're continuing as we get more of this data in a micro setting, we're continuing to demonstrate it in a macro setting so that we can our hope, and we have not done this yet, but something that we work toward is to be able to demonstrate even at the government level for whole countries or for regions of the world that providing access to the right diabetes technology for all of those who can benefit from it is not actually a cost, it's an investment. It's an investment in
Mhm.
the country's health, and it actually will save money. We have some data to know that now. Now we need to do some broader work in partnership. It can't just be, as you know, this work can't just be done by industry. For obvious reasons, I think there's a little bit of a cynical view when any industry leader puts out data that demonstrates the value of their product. I think this is really important where our collaborations with advocacy groups, with academic institutions becomes so critical because those studies have to be done in a credible, thorough way. That's how we generate all of our data in a way that is peer reviewed, that is credible, et cetera. And so I think we're at that point now where we want to see some of that data at the more macro level to again to demonstrate. When I was at ATTD last week, we met with prime ministers and advocacy leaders from countries around the world, and every one of them said that their biggest challenge is convincing their government that investing to support diabetes technology is not a cost, it's an investment in the well-being, and even for children with type 1 in some countries, this is still a challenge. So we like to say we're really pleased and proud with how far we've come on generating access, but we're not satisfied with where we are, and we're gonna continue to make this a priority, especially in terms of health equity for all of the populations who are right now being underserved.
I love the reframing of the cost versus investment. I think that's very tangible, especially in industry conversations and in business conversations with economic, decision makers in these countries. I think it's an important to see the long view, to zoom out and see, what a world with more access to diabetes technology could look like. Terry, I want to thank you for your time. I know that this was a very busy schedule, and navigating from one meeting to the next at ATTD was very challenging. But thank you so much for your time, and I appreciate you coming on the show.
Rob, my pleasure, and thank you for what you're doing and advocating for everybody with diabetes.